What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering what it truly takes to be an X-ray tech, as far as like your mental and as far how the field itself takes a toll on you and how to better prepare yourself, and like the more like just realistic approach that they probably don't teach you in school. This is just kind of on the job over the years how it comes to play. So to give you context, I am a night shift X-ray tech, part of the graveyard crew. Work a lot of day shift also, dabble in both worlds. So I will say that if you're joining the X-ray team and you work in the emergency room, half of the people kind of do. Other people work in ortho, surgery, wherever it has to do. Bones is, once again, the main bread and butter, because we also do fluoroscopy, which deals with the all internal organs and other stuff like that. But you deal with trauma, people not good, on a consistent level basis. To being honest with you, I'm antisocial by nature. So if you are one of the few people who are kind of like that and you're joining this field, just know that it will drain you, like your social battery, so much. Like by the time I'm out and about outside of work, you will see me majority of the times with my expensive Bode headphones on, just double downing on antisocial, because of the amount of stuff people do, and they come in and get hurt, and you understand, you're like, okay, so and so got hurt, okay, it's understandable, they're here to help. But sometimes people will do stuff that's like, you're like, why did you choose to get hurt and do something that's like not smart? And you like think, you're in your mind sometimes, how do people even survive out here in the NPC world? The way I see it is like, almost feels like you're working in the hospital in GTA. Anything can come through your doors, especially at night, from homeless people to regular folks to young people doing some like not smart stuff. And eventually you start to see how dangerous the world is and how it's full with like a bunch of people who are not that smart, and they're doing not so intelligent things, living their best life. And then you're just like thinking all the time, like, why can't you just stay home? Like, just stay home. Just like don't do nothing that will, it drains you so much. And like at the beginning of your career, you're so used to, you're like, oh, okay, you're just like helping, and then eventually you kind of get corrupted, and it kind of takes a toll of you, where you're just like trying to get it done so you can move on to the next. Like, yeah, you feel bad, and like, but like at the end of the day, you're like trying to just like get the best pictures and get out and go on to the next, and kind of like, it's kind of a churning troll. Like certain stuff, of course, like if you see a baby and they're hurt, like of course, especially me who's a father, like it hurts you at the core. Anything, like anyone who's like deep in danger, like true trauma, true like worthy ER stuff, yeah, it'll get you. Like you'll feel it, and like you'll feel bad. But other people who come in, literally, you see them. I work 7 days on, 7 days off. When I see you so many times to where I recognize you, I know your name, you come in for the same thing all the time, the level of, and some of them are like mean people. They'll like be mean to everyone, and like it will like you still, of course, because of our profession, you treat them with the same respect as everyone, same standard. But it kind of like, you're just like, I'm like, was this really an emergency room visit? Like, you could have went to your PCP, you could have went to urgent care. You come to an emergency room where it's like, if it's life or death, or on the weekends because everything's closed, type of situation. Like, was this really, like, you kind of start to question certain people's like ethics, and like you just start, like, a part of you is like, is this really, like, even some of the doctors, like you'll see them, you're like, they'll just be over it, they'll be like, like, really, again, for the same thing. And it astounds me the amount of x-rays I've done and the amount of lungs you see, and it's always consistently the people with the biggest lungs can never breathe. And then a part of me, because I mean, I'm not no doctor or nothing, but a part of me is like, do you think because your lungs are so big that it takes more oxygen? Of course it takes more oxygen to breathe. So like any variable of you getting just a tiny bit less oxygen in those massive lungs that take 2 X-rays to get, make you feel short of breath. Because sometimes I'll even go back in the report and they'll be like, remarkable, fine, perfect. And then you're just like, homeboy over there dying. Like can't breathe. And the X-ray shows up like there's nothing wrong with them. So like a part of me, just like random questions that will go through your head. Because I guess the sad part that you see someone, like I've even asked veteran techs who've been in the game like 20, 25 years versus like someone who's brand new, and then you just see it all the time. You see like the brand new techs coming in, hopes and dreams and sunshine, and I'll just like look at them and I'll be like, you must be new here. You must be like, eventually the amount of stuff you see and you see how the corruption goes, like it kind of like taints you in a way. But good ambition. But it's just the nature of stuff. Like you can ask anyone who's in this. You would hope as a normal person who's out there, you would think our profession has like, of course we have a set standard you always have to have, but like over time, overseeing certain stuff, it just kind of taints you and it makes you a little bit different. And even with the trauma stuff, like you'll see, like if you get especially with students, you'll see it, like there'll be a trauma, and I'm talking about like, let's say someone's femur just destroyed. Imagine you grabbed this like a femur, and imagine you just like shredded it up and it's just like broken in hundreds of like a lot of pieces, and then it's like skin ripped and everything just gushing and everything. And if you've been in the game so long, that's just another night. That's like a few traumas that you get to show your skills, and you get a little bit excited, and it's kind of messed up. You get a little bit excited because you're like, I wonder what this is gonna look like. But of course you still feel bad, but like me as someone who likes bones, because I mean I always like dinosaur bones, it kind of gets you interested to see like what's going on. Like, you know, like you have to be a little bit different than compared to being a nurse or other individuals in that kind of scene. And then like you'll go in, and then let's say it's a femur, you do your AP, your lateral, your cross table, whatever you got to do, and you just boom, 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 boom. And then I turn around and look at the student, and the student's like, oh, like, oh, like kind of like will freeze. And then like, cause you've been doing this so long, like your mind doesn't like connect like, oh, this is something serious, to someone who hasn't been like involved with it so much. You just like have to remind them like, hey, you still have a job to do. You understand? Okay, this patient's screaming, yelling, doing all the things, but you have to do this. And kind of like, I always see it, my brain kind of goes into like a robot mode. Like, of course I feel bad, of course everything, but I'm just kind of locked in. I'm like, okay, I got to do this so I can help this person. And to achieve this, I have to do this to get the most optimal picture so I can get him help. Even though this person is going to be like yelling and screaming and doing all these things, I have a job to do. And you kind of have to like lock in and do it. So you have to be a little bit different, because there's been times where I've even witnessed it, one good trauma, like some crazy stuff. You'll like, if you just Google some crazy trauma, like one of those on the internets, I seen one student walk out, was like, nah, it's not for me. I can't do it. And it's wild, because like this student was going through like about like a year deep into the program, and then saw something crazy, and he's like, nope, not for me. So you have to be, especially if you work in the emergency room or want to do, like, you have to be a little bit different. Some of the stuff you'll see, it can't bother you. You just have to, because at the end of the day, you have a job to do. You got to help these people. And I mean, we don't get as much credit as the nurses do. My lady's a nurse. She gets all the credits. and the doctors, of course. But we still, at the end of the day, play a good vital role in it. But just know that sometimes you gotta be built a little bit different, to be out here, because sometimes I'll be forgetting and I'll be talking to people outside of my field or my other family members who are an accountant or do like different things that are not in the medical world, and I'll tell them and they'll be like, "Are you okay, Miguel?" And I'm like, "Yeah, it's just another Monday. Like, you're just saving lives, doing crazy stuff." And other people are just like, you'll tell them something and you'll be kind of joking around about it, and they'll be like, "Miguel, that's serious." And you're like, clearly you don't have the same sense of humor. Because, like, it's weird and messed up to think about it. Sometimes stuff will happen. And, like, if you brought someone who's not deep in the medical world, not deep in the trenches, and doesn't deal with emergency room, like, they'll be like, "Miguel, that's messed up." But, like, other people, like, it's just another day, and, like, you just try to make your job as enjoyable and try to make the best of the situation. And stuff happens sometimes that it's not really funny, but, like, in the grand scheme of things, maybe the way the patient said it or because of what's going on, like, it becomes funny and people will laugh. And, like, let me give you an example. So one time a patient, about like a little kid, had I think it was his wrist was broken, right? So it was broken. I believe it was the distal part of his wrist got messed up. And they had to pop it back into place, right? So he was getting medicine. He was doing all this. He was kind of like with propofol, kind of oozy. And then we were like adjusting his wrist, and he was just like, it hurts. It hurts. And like his parents, like, "It's okay. We understand. Like, you can be fine. Like, you do whatever you got to do, son. So you can." And then out of nowhere, as soon as they pop them, the biggest F-bomb we've heard from this little kid, and everyone just laughs, and even like the parents start laughing because like it was just funny in them because like he was trying to be so proper, the kid, and then we all know like if something broke and they pop it in, it's gonna hurt. Unless they give you a lot of crazy amount of drugs and you're just completely passed out because of the propofol. And if you're semi-awake and there's a certain level of pain, it will still get to you. It'll be kind of subsided because of the drugs, but like some stuff is just situational like that. And yeah, I'm just here as a fellow of tech, giving you all the knowledge. And if you're still watching, I appreciate it because there's not a lot of people out here giving knowledge to the radiology peeps, to the new and the upcoming, for those in our field. There's a lot of nurses out here doing videos and stuff, but not that many people doing it in the RT world. So I feel like it's my responsibility to come and educate y'all and give you some of the knowledge, some of the insight that I've acquired. And I'll continue doing this and give you niche and very specific topics because I feel it's important to give back, to educate the rest of the peeps. And yeah, it's been your boy Miguel. See you on the next one.